The most frequently diagnosed cancers in the world include breast, lung, colorectal, and prostate cancers. Skin cancer, especially non-melanoma types like basal cell and squamous cell carcinoma, is also extremely common and affects millions annually. Beyond these, cancers of the bladder, kidney, also known as renal cell carcinoma, pancreas, and uterus rank among the more prevalent types. Additionally, blood cancers such as lymphomas and leukemias continue to impact a significant number of people. Each of these cancers has its own unique risk factors, symptoms, and treatment options, which makes awareness and early detection essential for improving outcomes. Understanding the variety of common cancers can help individuals stay informed and proactive about their health. Here's a more detailed breakdown.
Breast cancer. Breast cancer is one of the most common cancers diagnosed in women in the United States. But it's important to know that it can also affect men, though it's much less common. This type of cancer begins when cells in the breast start to grow out of control, forming a lump or mass that can sometimes be felt or seen on a mammogram. It most often starts in the milk ducts, ductal carcinoma, or the lobules, lobular carcinoma, where milk is produced. While many cases are caught early through regular screenings like mammograms, some signs to watch for include a new lump in the breast or underarm, changes in breast size or shape, nipple discharge, especially if it's bloody, and skin changes such as dimpling, redness, or thickening. Breast cancer risk increases with age and family history. Certain genetic mutations like BRCA1 and BRCA2 and lifestyle factors can also play a role. The good news is that early detection and advancements in treatment, such as surgery, radiation, hormone therapy, and targeted drugs, have greatly improved survival rates. Whether you're a woman or a man, it's important to pay attention to any changes in your breast tissue and to talk with your doctor about routine screening if you're at higher risk.
Lung cancer is one of the leading causes of cancer-related deaths in both the United States and around the world. It develops when abnormal cells in the lungs grow uncontrollably, often forming tumors that interfere with normal lung function. While smoking is the biggest risk factor, it's important to understand that lung cancer can also occur in non-smokers. Exposure to secondhand smoke, radon gas, air pollution, and certain occupational chemicals can also increase risk. Genetics and family history may play a role in some cases as well. There are two main types of lung cancer: non-small cell lung cancer, NSCLC, which is the most common, and small cell lung cancer, SCLC, which tends to spread more quickly. Symptoms may not appear until the cancer is advanced, but common warning signs include a persistent cough, coughing up blood, shortness of breath, chest pain, hoarseness, and unexplained weight loss. Are often used to detect it early. Treatment options depend on the type and stage of the cancer and may include surgery, chemotherapy, radiation therapy, targeted drug therapy, and immunotherapy. Advances in early detection and treatment are improving survival rates, but awareness and prevention remain key. Colorectal cancer. Colorectal cancer is a type of cancer that starts in the colon or rectum, both parts of the large intestine, which plays a vital role in digestion and waste removal. It's one of the most commonly diagnosed cancers in both men and women in the United States, and it often develops slowly over time. Most colorectal cancers begin as small, non-cancerous growths called polyps on the inner lining of the colon or rectum. While not all polyps turn into cancer, some can if left untreated. That's why regular screening is so important. It allows doctors to find and remove these polyps before they become a serious problem. Early stages of colorectal cancer may not cause noticeable symptoms. As the disease progresses, warning signs can include blood in the stool, changes in bowel habits, like persistent diarrhea or constipation, abdominal pain or cramping, unexplained weight loss, fatigue, or a feeling that the bowel doesn't empty completely. Risk factors include age. Most cases occur in people over 50. A personal or family history of colorectal cancer or polyps. Inflammatory bowel diseases like Crohn's or ulcerative colitis. Certain genetic conditions, a low-fiber, high-fat diet, and a sedentary lifestyle. The good news is that colorectal cancer is highly treatable, especially when caught early. Treatment may involve surgery, chemotherapy, radiation therapy, or targeted therapies, depending on the stage and location of the cancer. Routine screening, such as colonoscopies, typically starts at age 45 for average-risk adults. If you're experiencing symptoms or have a family history, talk to your doctor about starting screening sooner. Prostate cancer. Prostate cancer is one of the most common cancers in men, particularly those over the age of 50. It begins in the prostate, a small walnut-shaped gland located below the bladder that helps produce seminal fluid. While many prostate cancers grow slowly and may not cause serious harm, others can be more aggressive and spread quickly if not detected early. In its early stages, prostate cancer often doesn't cause noticeable symptoms, which is why regular screenings are important, especially for men with risk factors such as family history or being African American, as both are associated with a higher risk. When symptoms do appear, they might include difficulty starting or stopping urination, a weak or interrupted urine stream, frequent urination, especially at night, pain or burning during urination or ejaculation, blood in urine or semen, pain in the lower back, hips, or pelvis. In more advanced cases, screening typically involves a prostate-specific antigen PSA blood test and/or a digital rectal exam, DRE. While these tests don't diagnose cancer on their own, they can help identify when further testing, like a biopsy, is needed. Treatment depends on the cancer stage and how fast it's growing. Options may include active surveillance, watchful waiting, surgery, radiation therapy, hormone therapy, or chemotherapy. Many men with slow-growing prostate cancer live long, healthy lives with careful monitoring. Regular checkups and open conversations with your doctor are key to early detection and better outcomes. Skin cancer. Skin cancer is the most commonly diagnosed cancer in the United States, and it comes in several forms. The two main categories are melanoma and non-melanoma skin cancers, which include basal cell carcinoma, BCC, and squamous cell carcinoma, SCC. Non-melanoma skin cancer. Basal cell and squamous cell carcinomas are the most common types. They usually develop on areas of the skin that get the most sun exposure, like the face, ears, neck, and arms. Basal cell carcinoma often appears as a shiny bump, pink growth, or a sore that doesn't heal. Squamous cell carcinoma might look like a scaly patch, a firm red bump, or a sore that crusts or bleeds. These types generally grow slowly and are rarely life-threatening when caught early, but they can cause disfigurement if left untreated. Melanoma. Melanoma is less common but far more dangerous. It begins in the pigment-producing cells, melanocytes, and can spread to other parts of the body quickly if not treated early. Melanoma can develop from an existing mole or appear as a new, unusual-looking spot on the skin. A helpful way to remember what to look for is the ABCDE rule. Asymmetry, one half doesn't match the other. Border, edges are irregular, ragged, or blurred. Color, varying shades of brown, black, or other colors. Diameter, larger than a pencil eraser, about 6 millimeters, though they can be smaller. Evolving, any change in size, shape, or color. When detected early, most skin cancers are highly treatable. If you notice a new spot or a change in an existing mole, don't wait. Get it checked by a healthcare provider. Bladder cancer. Bladder cancer starts in the cells lining the inside of the bladder, a hollow, muscular organ in the lower abdomen that stores urine. It's more common in older adults and occurs more frequently in men than in women, but it can affect anyone. The most common type is urothelial carcinoma, also called transitional cell carcinoma, which begins in the urothelial cells that line the bladder. Other, less common types include squamous cell carcinoma and adenocarcinoma. Common symptoms. Early signs of bladder cancer often include blood in the urine, hematuria, which may make urine look pink, red, or dark brown. Frequent urination, pain or burning during urination. A feeling of urgency, even when the bladder isn't full. Lower back or pelvic pain in more advanced cases. Risk factors. Major risk factors include smoking, the leading cause of bladder cancer, as tobacco chemicals pass through the urinary system. Exposure to industrial chemicals such as those used in dye, rubber, and leather industries. Chronic bladder inflammation or infections. A family or personal history of bladder cancer. When caught early, bladder cancer is highly treatable. It also has a relatively high risk of recurrence, so regular follow-ups are important. Kidney, renal cell cancer, cancer of the kidneys. Pancreatic cancer. Pancreatic cancer develops in the tissues of the pancreas, an organ located behind the stomach that plays a crucial role in digestion and blood sugar regulation. It produces enzymes that help break down food and hormones like insulin that control blood sugar levels. This type of cancer is considered especially serious because it often doesn't cause symptoms in the early stages, making it harder to detect until it's more advanced. There are two main types: exocrine tumors, which are the most common and include pancreatic ductal adenocarcinoma; neuroendocrine tumors, which are less common and tend to grow more slowly. Common symptoms. Symptoms usually appear after the cancer has grown or spread and may include abdominal or back pain, unexplained weight loss, loss of appetite, jaundice, yellowing of the skin or eyes, nausea or vomiting, changes in stool such as pale, greasy, or floating stools. Risk factors. Several factors may increase the risk of pancreatic cancer, including smoking, chronic pancreatitis, long-term inflammation of the pancreas, family history or certain genetic syndromes, type 2 diabetes, obesity, older age, typically over 60.
Uterine cancer. Uterine cancer is a type of cancer that starts in the uterus, the pear-shaped organ in a woman's pelvis where a baby grows during pregnancy. It is the most common gynecologic cancer in the United States and primarily affects postmenopausal women, although it can occur at any age. The most common form is endometrial cancer, which begins in the lining of the uterus, the endometrium. A less common but more aggressive type is uterine sarcoma, which starts in the muscle or other supporting tissues of the uterus. Common symptoms. Early signs of uterine cancer are often noticeable, which makes early detection more likely. Symptoms may include abnormal vaginal bleeding, especially after menopause, bleeding between periods, pelvic pain or pressure, watery or blood-tinged vaginal discharge, pain during intercourse or urination in more advanced cases. Risk factors. Several factors may raise the risk of developing uterine cancer, including being over age 50, obesity, hormone imbalances, particularly excess estrogen, a history of endometrial hyperplasia, never having been pregnant, use of tamoxifen, a drug used to treat breast cancer, family history or genetic conditions like Lynch syndrome. When found early, uterine cancer is highly treatable. Regular gynecologic checkups and reporting any unusual bleeding can help catch it early and improve outcomes.
Lymphoma. Lymphoma is a type of cancer that starts in the lymphatic system. a crucial part of the immune system that helps the body fight infection and maintain fluid balance. The lymphatic system includes lymph nodes, the spleen, thymus, bone marrow, and lymph vessels. Lymphoma occurs when white blood cells, called lymphocytes, begin to grow and multiply uncontrollably. These abnormal cells can collect in lymph nodes and other tissues, forming tumors and interfering with normal immune function. There are two main types of lymphoma: Hodgkin lymphoma, HL. This type is less common and is marked by the presence of a specific abnormal cell called the Reed-Sternberg cell. Hodgkin lymphoma is often very treatable, especially when diagnosed early. Non-Hodgkin lymphoma, NHL, a more common and diverse group of blood cancers that vary widely in how they behave and respond to treatment. Some forms are slow-growing, indolent, while others are aggressive and spread quickly. Common symptoms. Lymphoma symptoms can be vague or mistaken for other conditions. Common signs include swollen lymph nodes, usually painless, in the neck, armpits, or groin. Unexplained weight loss, fever and night sweats, persistent fatigue, shortness of breath or chest pain, if lymph nodes in the chest are affected, itchy skin or rash in some cases. Risk factors: weakened immune system due to HIV/AIDS, autoimmune diseases, or certain medications. Certain infections, such as Epstein-Barr virus or HTLV-1. Family history of lymphoma. Exposure to certain chemicals or radiation. Thanks to medical advancements, many types of lymphoma are now very treatable, especially when diagnosed early. Leukemia, cancers of the blood-forming tissues.
Cervical cancer. Cervical cancer is a type of cancer that begins in the cells of the cervix, the lower part of the uterus that connects to the vagina. It is one of the most preventable and treatable cancers, especially when caught early through routine screening. While it's less common in the United States today, thanks to widespread Pap testing and HPV vaccination, cervical cancer remains a major health concern in many parts of the world where screening and prevention are less accessible. Primary cause. The vast majority of cervical cancer cases are caused by persistent infection with high-risk types of human papillomavirus, HPV, a very common virus spread through sexual contact. In most people, the immune system clears the virus naturally, but in some, it can lead to abnormal cell changes that may develop into cancer over time. Common symptoms. Early cervical cancer often has no symptoms, which is why regular screening is so important. When symptoms do appear, they may include unusual vaginal bleeding, such as after sex, between periods, or after menopause, watery or bloody vaginal discharge with a foul odor, pelvic pain or pain during intercourse. Early detection gives patients the best chance for a full recovery, which is why regular gynecologic checkups and HPV vaccination are key parts of prevention.
Thyroid cancer. Thyroid cancer develops in the thyroid gland, a small butterfly-shaped organ located at the base of your neck. The thyroid produces hormones that regulate your metabolism, heart rate, and body temperature. Although thyroid cancer is relatively uncommon compared to other cancers, its rates have been increasing, partly due to improved detection methods. The good news is that most types of thyroid cancer are highly treatable and often curable, especially when caught early. Types. The most common types include papillary thyroid cancer, the most frequent and slow-growing type, follicular thyroid cancer, medullary thyroid cancer, anaplastic thyroid cancer, a rare but more aggressive form. Common signs. Thyroid cancer often doesn't cause symptoms early on, but you might notice a lump or swelling in the neck, difficulty swallowing or breathing if the tumor grows large, changes in your voice, such as hoarseness, persistent neck or throat pain. Risk factors. exposure to radiation, especially during childhood, family history of thyroid cancer or certain genetic syndromes. Being female, thyroid cancer is more common in women. Age. Most cases occur between 30 and 60 years old. Thanks to effective treatments and early detection, the outlook for most thyroid cancer patients is excellent. Testicular cancer. Testicular cancer develops in the testicles, which are part of the male reproductive system and located inside the scrotum. Although it's a relatively rare cancer compared to others, it most commonly affects younger men, typically between the ages of 15 and 35. The good news is that testicular cancer is highly treatable, and early detection leads to excellent cure rates. Common signs. Early signs of testicular cancer may include a lump or swelling in one testicle, a feeling of heaviness in the scrotum, pain or discomfort in the testicle or lower abdomen, a sudden buildup of fluid in the scrotum, enlargement or tenderness of the breasts in rare cases. Risk factors: undescended testicles, cryptorchidism, family history of testicular cancer, personal history of testicular cancer, age, most common in young and middle-aged men. Thanks to advances in treatment, the majority of men diagnosed with testicular cancer go on to live long. Brain and other nervous system cancers. Brain and nervous system cancers include a variety of cancers that start in the brain, spinal cord, or the nerves throughout the body. These cancers can affect people of all ages, though some types are more common in children and others in adults. Because the brain and nervous system control so many vital functions, from movement and sensation to thinking and emotions, tumors in these areas can cause a wide range of symptoms, depending on their size, type, and location. Types. There are many different types of brain and nervous system tumors, including gliomas, which arise from glial cells that support nerve cells, meningiomas, which develop in the membranes covering the brain and spinal cord, medulloblastomas, more common in children, schwannomas, affecting the nerve sheath cells, pituitary tumors, affecting hormone production. Some tumors are benign, non-cancerous, but many are malignant, cancerous, and can grow aggressive. Common symptoms. Symptoms vary widely but may include persistent headaches, seizures or convulsions, changes in vision, speech, or hearing, weakness or numbness in limbs, difficulty with balance or coordination, memory problems or changes in personality. Risk factors. While many brain cancers occur without a known cause, risk factors can include exposure to high doses of radiation, family history of brain tumors, certain genetic conditions. While some brain cancers are very aggressive, advances in treatment are improving survival and quality of life for many patients.